Before I do start today, I do want to begin by acknowledging that the land that I have the privilege of joining today has been held in care, respect, and stewardship by the Indigenous nations. And I want to start by acknowledging the surrounding Indigenous communities of the Oneida Nation of the Thames, the Munsee Delaware Nation, Chippewa of the Thames First Nations, and I also acknowledge the current urban Indigenous population. I feel honored and blessed to be able to live, work, play, and share knowledge from this shared land. So it's with gratitude that I begin this presentation today. Again, welcome to all of our members of our monthly membership and to all of those who are joining today. We have opened up today's webinar as a free trial, basically, to see what types of information, what you can expect on a monthly basis as a member. We are asking that you please mute to your microphones during this presentation today, just to allow everyone to have the best listening experience. If you have any questions, please feel free to enter those in the chat box. I will be checking that periodically, but really just leaving most of the question and answer to the end of the presentation today, as I do have a lot to get through. I will be quickly going over our topic of today, which is managing accommodations for upper extremities. But we do have many more webinars, toolkits, and trainings that are available on our website if you're interested in learning more about that. I'll be saving a little bit of time at the end of the presentation today to talk about our membership and what's involved or included with that, and how to join and get involved. Some online workshops and upcoming training that we have for the year are listed here. So we have so many great programs that we've developed for you that are taking place virtually and instructor-led, as well as some in person as well, getting back to in person. And we also have those ongoing online certificate programs. So here is a good overview of what we're looking at for this year, but please do check out gowanhealth.com to learn more about those programs, or feel free to reach out to us if you're interested in any of those programs specifically. I'll start by introducing myself. For anyone who hasn't seen me before, it's likely that you've seen Nancy Gowan, the other lady in this photo. And so Nancy is the founder of Gowan Consulting, and I am the new owner and CEO. I guess not new anymore, but I am an occupational therapist as well as a clinical lead and the owner and CEO of Gowan Consulting. So welcome to everyone who I haven't met before and everyone who I have met before. Great to have you here. Quickly about Gowan Consulting and who we are. We have 24 years in private business and offer services across Canada. We're an organization of occupational therapists that focus on function, ability, and work. So we provide services such as ergonomics, accommodation support, helping individuals to stay at work, to return to work, to care for their mental health. And we also provide training and policy development, as well as other workshops. Our goal at Gowan is to make the complex simple, knowing how difficult it can be to help individuals to stay healthy and productive and successful in their roles. So really helping you to make that simple. We work together for your healthy business. Now on to our agenda for today. We are going to cover information about upper extremity conditions. So today we're talking about musculoskeletal disorders, specifically those that affect the upper extremities. Talking a bit about ergonomics and how we prevent upper extremity musculoskeletal disorders, as well as reduce aggravation of that, looking at ergonomics. We're going to look at a bit of research on the treatment and prevention of upper extremity conditions, talking a lot about postures and positions, reducing repetition in the workplace, reducing force. And as we look at all of those, what are some potential accommodations for someone who may be recovering from an upper extremity condition? First off, I'd like to start by defining musculoskeletal disorders. So when we talk about musculoskeletal disorders, we're looking at injuries to the musculoskeletal system. So that's our muscles, tendons, ligaments, spinal discs, our nerves, joints. our bones and our blood vessels. So all of those structures that keep our body in the structure and also allow us to move and interact with the world. Now, these types of disorders are caused by risk factors, and often these risk factors can be present in the workplace. It's important to understand that musculoskeletal disorders are progressive, and these risk factors that are in the workplace often lead to either a development of a musculoskeletal disorder or an aggravation of a pre-existing condition or disorder that is already there. These are not the types of injuries that are caused by a sudden event or a single accident, such as a fall or a vehicle accident involving an external force. They really are progressive and gradually can get worse over time if we're not paying attention to taking good care of our ergonomics as well as proper treatment for these conditions. Specifically, we are going to be focusing on upper extremity conditions. So I just wanted to start by listing some common upper extremity conditions here. Some conditions such as thoracic outlet syndrome, carpal tunnel syndrome, epicondylitis or tennis elbow, rotator cuff conditions, neck strain, tendinitis, and ganglion cysts. So these are all types of musculoskeletal disorders that do occur in the upper extremities, and really they are aggravated or develop due to risk factors that are present in the workplace, which we will discuss in detail today. Musculoskeletal injuries or disorders, as mentioned, do occur or progress in stages, which means that it's really important to pay attention to the body and when the body is giving you signs or symptoms that it may be developing a musculoskeletal disorder. As we move through these stages, it takes more and more care and treatment to be able to get back to healthy or to recover that injury. So looking at stage 1, we're looking at injuries that may result in aching or just general fatigue. We're looking at symptoms that are pretty nonspecific and they occur during certain tasks. So we notice that potentially while we're keyboarding, we're getting an aggravation of some wrist pain. And generally that's aching or that's fatiguing. But as soon as we stop that activity, that goes away. So we don't notice that carry over into other activities of our life. Stage 2 is that more recurrent pain. So we've continued using our wrist in the same way or working in the same positions, and we are getting this pain that is consistent or recurrent. So it comes back and we see it across different activities. So not just at work, but even after work. So it can start to impact our household tasks and the activities that we're engaging at in home. So for instance, maybe we're noticing not just when we're keyboarding now, but when we're also trying to lift and carry the laundry bin at home. At this stage, the injury or disorder is reversible with treatment and looking at the ways that we work and changing the ways that we work. So looking at the positions that we're working in, our ergonomics, and also getting the proper treatment to help get back to healthy. Stage 3 is where considerable disability can start to happen with these musculoskeletal disorders. So this is pain pretty consistently. It happens at work, it happens at rest, it happens during the nighttime when we're sleeping. We're noticing it through all activities of our life, and it's starting to really impact how we engage in all of those activities. So it's even those non-repetitive movements or activities or movements that generally wouldn't have caused or contributed to that pain, but we're still noticing pain, aching, or symptoms. At this point, it may never be reversible, even with that treatment or stopping work or stopping those activities that do cause that pain. The really important thing here is that the earlier it's noticed, the earlier there's treatment for a musculoskeletal disorder, the better likely the prognosis for recovery. You're probably wondering, how does this happen? So there's some factors within the work, within a person's personal factors, psychological factors, as well as the workplace that can lead to this injury. But what happens is if we are sustaining muscle movement or work, or we have repetitive work, so doing the same movements over and over, especially if those are in really non-neutral postures or awkward positioning, that causes fatigue of a muscle. And once a muscle fatigues, or once we don't have enough recovery for that muscle, it leads to tension. So that muscle gets tighter and the blood flow or circulation to that muscle decreases. So we're not able to clear that lactic acid that builds up in the muscle. And overall, it's getting weaker as this happens. And that injury really is resulting from the weakened muscle, the lack of blood flow. And sometimes it's really that compression or micro trauma that can happen in these structures as we work in certain positions or we move in certain ways. To help us better understand how and why that happens, it's important to think about the body's anatomy and the way the body works and moves. So the first and most important thing to understand is that the head bone's connected to the neck bone, and we know the neck bone is connected to the rest of the body. And the reason that I bring this in here is because it's important to understand that the whole body is connected. So yes, we are focusing today on upper extremity conditions, but if we completely ignore the rest of the body, we're missing a lot of the story. So when we're analyzing positions or we're determining accommodations, we need to consider what the whole body is doing and not just the upper extremities, because the position of our spine is going to impact how our arms function and how we're able to reach and lift and carry items. So we do need to consider the whole body and how we're working and moving. The structure that connects us all really and houses our nervous system, our spinal cord, and is so important to protect and consider the position of is our spine. So our spine is that those backbones, they keep us upright, and they are composed of many different structures. So within the back, we have our vertebrae, which are those bones. We have 3 levels of our vertebrae, our cervical, thoracic, and lumbar. In between our vertebrae or our bones of our back is our discs, so our intervertebral discs. Which really function like a jelly donut. So they allow us to absorb shock, and they also allow for some movement. However, with too much movement or the wrong types of movements, there is potential for that jelly donut or that disc structure to start to press on painful, sensitive structures within the back. We have ligaments, and the ligaments are the structures that connect our bones together. They restrict too much movement and allow us to have that structure. We have our muscles, which allow us to move, and what connects our muscles to our bones is our tendons. And we also have our nerves, very importantly, that run all the way up and down this back. They're that highway or that connection between our brain and the rest of the body. And they really are that control system of our body. So it's so important to consider how we're moving so that we can protect our nerves and we're not aggravating conditions with our nerves. When we think of proper posture, we think of this S curve in the back. So we don't actually have a flat spine. Our spine is actually curved like an S, which is the position it likes to be in the most. It's the position where force is mostly safely generated through the spine. And we really look to maintain this curve. So as we're considering how our workstation is set up, or where the items within our work zone are placed, we're thinking about this posture and what types of movements we're required to do and how that impacts the spine. When we zoom in a little bit on the upper extremity, it's important to consider all of the structures that help to support an upper extremity. And really all of that originates at that spine or that cervical section of the spine, which is the neck. And the structures that come from that is our nerves, and our nerves that are supplying our arm and our hand originate there. It's interesting because carpal tunnel or carpal tunnel syndrome is actually one of the most misdiagnosed conditions, because most people assume that that comes from the wrist. However, carpal tunnel syndrome, really by definition, is compression of the median nerve. And that nerve starts up there in our neck. So we need to consider neck positioning. We need to consider the heights of our work and the position of our shoulder. Because if you look here, really there's so many structures that go in that complex shoulder joint that have the potential for damage if we move in the wrong ways, if we move repetitively, or if we're lifting too heavy. So it really is about joint protection because we're looking at all of the nerves that come out of there. We're looking at the blood vessels, as you can see there, and also our muscles, and you can see the tendons there that attach the muscles. We also have a very complex forearm. So when you look at the anatomy of the forearm, what you see there, those white structures, those are the tendons that connect that muscle to the hand. And what you see is most of the muscles that actually control the hand begin in the forearm and actually live in the forearm. And they all travel through this really small space in the wrist, which is known as the carpal tunnel. So we know that these are small muscles, but they're also lengthy. So they can get really aggravated with overuse. That's those same muscles that bend your fingers go all the way up to your elbow. So it's really important to consider position of the wrist and what we're doing with our hands. When we think about upper extremity and musculoskeletal conditions in general, what we think about is three different factors that can impact the development or the progression of those disorders. So we look at the person. So what are some personal factors? There are work factors, so about the job itself, and then workplace factors. So I'm going to go through each of those in a little bit more detail. When we look at a person, there are some different ways that our bodies are made up, the ways that our bodies move, the ways that our bodies function that can impact the chance that we may develop a musculoskeletal disorder. First, we look at physiology. So really, how do we get our blood through our body? What is our cardiovascular health and system like? Are we able to circulate oxygen through our body, the function of our lungs? We look at nervous control of movements. So how is the nervous system functioning? And does it modulate and control our movements appropriately? And there may be impact of neurological conditions. Body size and anthropometrics, so the way that we're built really can impact our susceptibility to developing these conditions. As an example, females are more likely to develop carpal tunnel syndrome because we do have smaller wrists. So that area is more compressed than a male who may have a larger wrist size. Fatigue factors, so how tired you are throughout the day, how much energy you have available for the rest of your body and for your muscles and for doing the activity that you do throughout the day. Our mental health and our ability to manage stress can impact our physical health and how our body can recover and function. The control or work demands, so how much control you have over your work or your life and how many demands are placed on you, whether that's personal or professional. And the type of work, so team or individual work. So do we have to work together with others? If we're working in a team, aspects of work are sometimes harder to control. Whereas if we work individually, there may be more control, more autonomy, more ability to take breaks as we need them rather than as the team allows. When you think of teamwork, potentially lifting as a team, you can't control how someone else is lifting or the pace that someone's lifting or the way that that impacts your body. Or if there's conflict in teams, going back to mental health and stress management, if you're always having conflict in your teams, that is going to impact as well how your physical body presents. Within the work that we do, we look at different aspects such as the process. How do we fit into that process? Depending on how our work impacts the rest of the organization or task completion can impact how fast we have to get that done or what our productivity requirements are and how that impacts the rest of that work process. Repetition, how many times a day do you have to do the same movement or same task or same lift over and over to be able to achieve your goals? We look at postures, of course, and the positions that are required of your body to be able to do the work that you're doing, whether that is a physical job where you're lifting and carrying items throughout the day, or maybe you're required to move patients in their bed, or maybe it's computer work where you are repetitively using the mouse. Depending on what task you're doing, it really will dictate the postures that are required from your body. And there are more higher risk postures that are associated with musculoskeletal disorders. Another risk factor is forces. So looking at external and internal forces. So internal forces is the amount of muscular energy or force that your muscles have to generate in order to do a certain task. Whereas the handling and the loads that we're handling are the external forces. So what are we lifting, carrying, pushing, pulling? Forces can even be those small muscles within our hands required to click the mouse all day. We also look at shifts and how is the work day designed? So are people able to take breaks? Is there flexibility in work, or is it very strict breaks where people have to work a certain amount of hours without getting that chance to take those breaks? And depending on the positions that people are in or the work that someone's doing, that can impact musculoskeletal disorders. Looking at the outcome of the process, so what is that final product? What are we trying to achieve in our work? And what are the productivity measures or demands? So looking at different types of work, hourly work or salary work versus piecework, where we're paid for each deliverable or each part that we produce. So in that case, being more motivated to make more money and work for longer because we get more pay. It really doesn't allow for as many rest breaks. And the workplace. So this really is the environment that somebody is working in. Looking at the location of work. Is there a commute required? And how long is that commute? Can impact the amount of time someone is spent in a sitting position or sedentary. Inside versus outside work and the type of industry or setting someone works in can impact disorders. And heights of work. So the heights that we're working at impact the whole body. We talked about that connection. So if we're working at low levels, we're going to be bending through the spine and developing these awkward postures to be able to do work. Or if we're always working at a computer and our monitor is way up here, then that's going to impact our neck positioning and our back positioning. Or are we reaching above head to be able to work? So what are the heights of the work that we're working on? And again, it feeds back into our individual factors as well. So I might be a different height than you are. So if you've got a short person working at a workstation that is the same height as someone who's tall, there's different postures required to be able to work in that same workplace. So considering the adjustability of workstations as well. Looking at arm spans, so again, knowing we all have different arm spans, but really how easy is it to access the tools that someone needs to access throughout the day, whether that be on your desk or whether you're on a factory line where you have to be accessing different tools throughout the day. How close are those to your body, which is going to impact positioning as well. Overall, looking at the neck, back, and head postures required to be able to do the work in that workplace. And what type of room do you have to be able to manipulate items, to move things? If you have limited space, you might be cramped, or you might be moving in different ways to be able to reach into bins or to be able to move things in a really confined space. So that may impact the way that your body moves. How long do you spend sitting? How long do you spend standing? Are you required to walk throughout the workday? And computer workstations. So looking at the design of computer workstations and how they allow someone to work in the most comfortable and efficient way. We also look at line work versus independent workstations and the ability to make adjustments there. So if someone's working on a line or working in a team environment, adjusting one part of that workstation or workplace may have implications on the rest of the line or the rest of the team. So thinking about how that impacts versus individual or independent workstations, which may be more adjustable or may have more control over that. Now, when we put all of this together, what we're really looking at is ergonomics. And ergonomics is a science that looks at designing jobs and designing workplaces in a way that is safe, that helps with effectiveness, so makes it easier to do the job, that minimizes the possibility that someone will harm themselves. And also by designing workplaces in this way that take into consideration all of those factors, we minimize errors, we maximize quality, and we maximize productivity of work. Ergonomics at its core is about fitting the workplace to the person, not the other way around. And you'll see, based on all of those factors that I just talked about, it's really important that we're not asking a person to fit themselves to a specific mold, because that's when we get into awkward positionings. People have different tolerances for abilities to lift things. So really, does the workplace allow someone to stay safe, efficient, and productive? When we think about the workplace and development of musculoskeletal disorders, it's really important that we actually can observe someone completing the work, because this is where we get information about postures. So it's important to see how someone moves, how someone is lifting items, because an employee may say, well, I'm not moving into those awkward postures, or I don't move outside of my neutral position. But as we watch them, that might actually be the case. One factor for that is employees may not be educated around what those positions are. But also, when we assess a workstation, we don't just look at the workstation. We need to look at how the person interacts with that workstation. Well, take the example earlier, I mentioned someone who's shorter and working at a workstation, where for a taller person, that is in line with their body, but they're shorter. So now what we see is they're going to have to reach up to access the same tools. So the posture that was involved or required of someone who's taller may be very different for someone who is shorter. So we need to actually see the person completing the job. And what we're looking for when we do this is those postures, looking at some specific risk factors that can lead to or aggravate upper extremity conditions. Now, again, as a reminder, we're not just looking at the upper extremity. So we're not just looking at the shoulders, the elbows, and the wrists, but we need to look at the whole body and how the body interacts and moves. For example, we need to look at the neck. We need to look at how the neck is moving. Now, what we know is that we all move into some awkward positions, or we move into positions that are outside of neutral range. However, it's those movements or those tasks that require sustained or repetitive motion when we're working at the end of these ranges. So being aware of what that looks like. In terms of the neck, it looks like bending sideways. Before we had headsets, many people would hold the phone between their shoulder and their ear. And now that can really aggravate tension that occurs in the neck and shoulder. So we have now this ergonomic tool of a headset that most of us are familiar with. We look at, are we bending forward with the neck, or are we bending backward, depending on the heights that we're working at? And how is the back moving? Does the task that someone's doing require them to bend forward or bend to the side, or twisting? And wrist position, so trying to avoid awkward bending of the wrist. So when we are working with specific tools, how does our wrist move? Looking at reducing flexion and extension and deviation of the wrist. Also, evaluating shoulder. We looked at that thoracic outlet earlier and how complex that shoulder joint is, which really puts it at risk for injury. So looking at any reaching that we're doing, how far do we have to reach? How high do we have to reach? And how often do we do that? Because that may lead to development of these musculoskeletal disorders. So some things to look out for is side reaching or abduction of the shoulder, anything where we're backward reaching or forward reaching with the shoulder. Here's an example of a computer workstation. So looking at where all of the tools we use, and I'll use the computer workstation as an example, but where do we keep our input devices? So our keyboard and our mouse. And are those in a place where our shoulder can be protected, where we don't have to lean forward, where our neck stays in the proper position? So when we look at a computer workstation, we're looking at, do the keyboard and mouse sit at a level where we don't have to reach above our shoulder height, where we don't have to reach forward consistently all day? As well as, where is the monitor or the screen located? Because that is going to impact where our neck is positioned. Specific to upper extremity conditions, some of the risks that are associated is really looking at shoulder positions that are sustained or repetitive over 60 degrees of flexion, extension, or abduction. Now, what that may look like is raising your elbow above mid-chest height. So if we're reaching up here, anywhere above mid-chest, that is a risk factor for this musculoskeletal condition. If we reach forward further than 20 degrees, so if we're looking at anything that requires us to reach outside of our reach zones and lean forward, because again, as we're connected, that not only impacts how our shoulder is positioned, but that also impacts how our back is going to end up being positioned, because that would require us to bend forward in the back as well. And then we look at wrist deviation. So we really want to keep the wrist in a neutral position, or this straight position. Once we start doing any movements requiring extension of the wrist, so this bending backwards, really stretching of those structures and pulling on the carpal tunnel, or supination movements, so where we're twisting the wrist upward, are aggravating factors for those conditions. In reference to reaching, what we think about, whether we're doing computer workstation or whether we're working in a factory line or whether we're working in a hospital, is really, where are we reaching and where are we required to reach? So we can break down our workstation into 3 different reach zones. What we see is that we have a primary reach zone. So that primary reach zone, as you can see, is anything that you can reach with your elbows bent at your side. And those are the things that you're using very frequently. So you'll see no reaching really is required to do that. The elbows stay at 90 degrees, and we're not raising the shoulder forward to access those tools. For me, working at a computer, that's my keyboard and my mouse. Then we have the secondary zone. So that's for more infrequent reaches, things we may have to use throughout the workday, but not all the time. And that really is anything that we can reach when we stretch our arms out in front of us. And you'll see the range there as well. So those are things where we do have to reach our arms forward. So we're still getting that awkward positioning in our shoulder, but we're not having to reach past that. So our spine can stay in a generally neutral position there. Tertiary zone is really occasional reaches. So things you are really not using frequently, but that you might need throughout the week or once in a while on your desk or at your line or at your workstation. Those are things that are beyond your fingertips, so that you would have to move into awkward positionings within your back, or hopefully be able to move your feet to be able to access those items. So thinking about position of your work items and how you keep those organized, and how your employees are doing that as well. We also need to consider the hands, how we use the hands and the position of the hands and the wrists that are required when we do work with our hands. So understanding that there are different types of grips, and different types of grips are more appropriate for different tasks. So looking at the power grip versus a hook grip versus a pinch grip for precision tasks, and considering the weights that are being lifted and matching the grip to the weights and the handles that we're using. Considering or trying to use larger muscle groups where possible. So trying to avoid really small repetitive finger movements. Again, as we saw the anatomy of the forearm, anything I'm doing to control here is actually generated up here. So we really are using those long tendons that go through that wrist to be able to do really small hand movements. So if we can instead use our arm a little bit more and use bigger muscles, then we can reduce the tension there. We also want to try as much as possible to keep our joints in that anatomically neutral position. So really avoiding any of that deviation, flexion, extension that is going to cause micro trauma to the structures. We want to reduce force and repetition where small muscles are needed. So if we do need to do precision work with our hands, looking at how much force are we lifting with that? Are we moving items with those small muscles of the hands? And what is the repetition required for that? And is there any way to reduce that? And then allowing for proper rest breaks and also proper tools to be used, which we'll talk a little bit more about. So what if someone does have a upper extremity condition and we need to provide an accommodation to someone who is either returning to work from that condition or staying at work with that condition? And how can we adapt the job, the workplace to be able to support someone to continue working? If someone has been off work, we want to consider what is their function and making sure that we have functional information to be able to support someone to come back into the workplace. A lot of times healthcare providers, they will provide you with notes and really being able to ask the right questions. So if someone says the individual is aggravated when they're keyboarding, you want to be able to ask, okay, what is that posture? Or what is that position of the wrist or of the elbow, of the shoulder that we're trying to avoid that is aggravating that condition? What are the forces that are aggravating? How much repetition can someone handle until they do have aggravation of that condition? And what are the limits? And if you're not able to get that functional information from the treating healthcare provider, looking at an external source to be able to come in and do that functional assessment to give you that objective and quantitative information that you need to be able to look at the whole job as well, such as an occupational therapist. You also want to look at job match. So based on the information that you have about function and what an employee can do and can't do, it's looking at the job as a whole. What are the tasks that require these aggravating postures? And can those be modified based on the equipment we're using or the position someone has to move into? Or maybe it's a restriction on repetition. So maybe someone can do a certain amount of repetition, but their job requires more than that. So how do we adapt that to be able to fit within that, those guidelines? We want to provide ergonomic assessments always when someone's returning with an upper extremity condition or when someone's at work with an upper extremity condition, knowing that there's so much that can go into contributing to that, making sure that their ergonomics are set up properly as well. We want to look at, again, so talking about what are those aggravating postures? What are those aggravating forces that are going to contribute to that or cause that to get worse or slow the recovery of that? We usually want to return someone gradually back to a full workload. So what is a gradual return to work plan or return to full duties that are going to allow that person to build up the capacity to do that rather than jumping into lifting what they always lifted when they were at work? And how does someone manage their own symptoms? Do they have the ability to take the breaks to manage their symptoms? Do they have their own symptom management strategies that they're able to engage in throughout the workday? And also thinking about symptom management as a whole, educating employees on the impact of their activities outside of work. We have a 24/7 body. We use this body for everything we do, even sleeping. So some activities outside of work may be aggravating that, which may lead to an unsuccessful return if they're not aware of how that can aggravate their conditions. So if someone is working on a computer and they're trying to return to working on a computer and you've set up their ergonomics well, maybe you've given them assistive technology so they don't have to keyboard as much. But if they go home and they're doing housework all night, or they're working with tools and doing home projects all night, where their wrists are going to be in a aggravating position, then that return and the efforts that you've made in the workplace are not going to make a difference. If the employee has braces or tools to be able to help them to work, looking at the research around that, are these the best option? Making sure that, for example, back braces. So back braces that support the core and are said to support the back have actually been shown through the research that they can cause our back muscles to weaken, which in the end actually causes more ability or susceptibility to an injury. So is that the best option? Whereas a tennis elbow brace or a brace for lateral epicondylitis is actually protective because it holds that muscle and secures that, helps to protect that tendon from pulling away from the bone. So knowing the braces that someone's using and being able to do a little bit of research on that and make sure that that's the best option to be using in the workplace. In 2016, there was a review completed around all of the evidence around prevention for upper extremity musculoskeletal conditions. So they looked at a variety of different studies that have been completed and the level of evidence in those studies to be able to develop these guidelines around what the strong evidence is, moderate evidence, and what are those things that just have no effect. So what they found actually is the only thing that was found to actually have strong evidence support for it for preventing musculoskeletal disorders was having resistance bands exercises at work. So some type of exercise programs were incorporating a bit of strength building and encouraging that. There was moderate evidence that stretching programs, well thought out, and encourage stretching throughout the workday can also prevent musculoskeletal disorders, as well as upper extremity support. So for example, when we're working on the computer, making sure people have armrests that are set at the proper position to be able to support upper extremities. They also showed moderate evidence that vibration feedback on a static mouse can actually help to prevent musculoskeletal disorders in the upper extremities. So when you are using the mouse, if your hand stays resting on the mouse, you would get a vibration feedback to basically remind you to keep your arm in a more comfortable position when you're not using the mouse. And they did show some moderate evidence for supportive, a positive effect for that. Now, these are items where we want to be careful about believing in their effectiveness and also really doing the research before we implement any of these programs, because there was moderate evidence that there's actually no effect of the following. So job stress management training. So when you're just training people on job stress and how to manage their own stress, that actually had no effect. EMG biofeedback training also had no effect, as well as, and this is important, workstation adjustments alone without worker engagement. So it's important that we're looking at the workstation, but we need the worker to be involved. So not only when we're assessing and making changes, do we need to be able to see how that employee is moving and how they're interacting with their workstation, but also when we're making that change, those changes, are we educating the employee? Are we giving them the empowerment and the education that they need to take care of themselves and engage in the proper positioning, as well as know how to make those adjustments for themselves. So really engaging the worker, providing education and behavioral change is the only way that you can see changes with workstation adjustments. I want to touch quickly on this just for all you employers and human resources professionals today and health and safety teams, just regarding the program of care at WSIB for musculoskeletal conditions. So basically this is for anyone with a WSIB claim related to musculoskeletal conditions. And it's really centered around the better at work philosophy. So employees are encouraged to be either returning to work or staying at work while completing this program. It's for those individuals or workers with a WSIB claim, and it must be made within 8 weeks of the date of injury or recurrence. Again, they have no flags or contraindications to participating in that program, and they must have a diagnosis of one or more injury involving muscle, tendon, ligament, fascia, interarticular structure, basically all the structures we talked about today. So musculoskeletal disorders. Again, it's 8 weeks, starting with an initial assessment and a minimum of 6 visits. So there are different components of this program of care, which may include education, modifying activities and giving individuals the ability to know what activities to modify and how to modify them, exercise therapy or physiotherapy, manipulation or mobilization, massage techniques, there may be electro or thermal modalities. So it's really a holistic program in assistance for the worker getting back to their regular function. One of the first principles we need to think about when we're accommodating individuals with upper extremities or returning them to work is thinking about their ergonomics. So looking at the ergonomics in all environments, I've put a picture here of a computer workstation, but this applies to all workspace environments. So whether someone's working in a hospital or working on a factory line or working outside in construction, providing the education and adjustments that someone needs for proper ergonomics is very important in being able to support someone with upper extremity conditions. Everyone on the line today who is part of our membership, you do have access to our self-assessment for your workstation to provide to your employees to be able to do these ergonomic reviews and identify potential changes that can be made. So those of you who are members, you do have access to that through the membership site. Another principle for accommodation and thinking about protecting musculoskeletal conditions in general is reducing the amount of repetition someone is engaging in for certain movements and activities. So that's maximizing the amount of time someone has, looking at what are the productivity standards. So if someone's working on a line and they have to complete 40 repetitions in order to meet their quota, but their aggravating factor is around 30 repetitions, how can you look at modifying that as the employee is returning to work to allow them to recover while still working and staying within those guidelines? So looking at reducing those productivity standards in the shift. Looking at, is there an option or ability to reduce the amount of lifts or frequency of lifts that someone has to do? Is there job rotation or task rotation? Instead of doing this heavy lifting activity that at the time someone's not able to do, can they engage in a different activity instead of that heavy lifting activity? Looking at work and rest schedule, so being able to appropriately pace someone's workday, allowing them to engage in symptom management strategies or the modalities that they use to be able to manage pain or help with their recovery. And again, that gradual introduction of the work demands, especially those factors that may be aggravating. Now, the second ergonomic principle looks at reducing the amount of force someone needs to generate in order to do their job. So we look at minimizing weights. Can the weights be divided between coworkers, or can someone, or can you have a coworker help with heavy lifting? What are the types of containers people are lifting? Can it be more trips instead of a heavy lift if that's the requirement? Are there mechanical devices, or are there trolleys that someone can push instead of lifting and carrying? Using conveyors possibly to transfer items instead of having to walk them and lift them back and forth. Looking at handles and hooks on containers to improve the efficiency of hand use and the safety of hand use. Looking at the tools someone's using or the materials someone's using and seeing if lighter materials or tools can be used. Are there ways to balance forces or counterbalance the tools that someone's using to take off some of that weight? Looking at the items someone's handling. What are the shapes of those items? Are they really long where someone has to bend forward to be able to lift and carry? Is there a way to change the shape? Or maybe it's different containers that someone's using and lifting. Looking at the carts that are being used and having larger wheels, which require less force to push. And then looking at work surface. So does the work surface, if we're using carts, does it allow that cart to move easily on the floor? And finally, we look at body postures. So what we want to do is minimize those awkward positions that people are required to move into throughout the workday. So looking at minimizing reach and minimizing the height distances. So looking at steps, if someone needs to get up to a high surface where they aren't able to lift overhead, do we have a step stool for them to be able to get up to that top shelf? Looking at the heights that we're stacking items, and instead of stacking things shoulder high, can we instead stack those a little bit lower and create more stacks so that person doesn't have to reach or lift above their shoulder? Looking at the optimal level for shelves being in between someone's knuckle and someone's shoulder. So again, avoiding overhead lifting, overhead reaching. Looking at avoiding deep shelves, so something that someone has to lean into or kind of contort their body in an awkward way to be able to bend down and then lean into a shelf. Those can really create some awkward positions. What is the best location for bins, for items, for tools to be stored in to minimize reaches and heights? Looking at chairs. If we're seated in chairs instead of having to move the full chair, is there a swivel? Are there wheels on the chair? All accessibility, so accessibility of the workstation, accessibility of the items that we're working on. Does the item have enough grip for someone and proper grip? And then we really need to think about heavy work. So individuals with upper extremity conditions are going to have a lot of challenges with heavy work. And when we look at heavy work, we want to look at reducing all of those risk factors. So how do we impact the weight, the amount of force someone needs to lift? Also the positioning and posture, because heavy work really impacts all of this. So is there any mechanical power or any mechanisms that can be used to be able to make that work lighter? Being able to vary that work. So can you rotate that job or that task with lighter work to allow someone to have rest breaks and use those upper extremities less often? Looking at rest breaks, again, including rest breaks and pacing throughout the job. And then just all of those ergonomic factors. So weight, shape of the load, how often the worker lifts that load, making it easier to handle. So are there handles on it? If not, is there a grip on it where it's easy to lift and move? Where are we storing things to make that easier? How far does someone have to lift a load? Do they have alternatives to that? And what types of other positions does someone have to engage in? Are they twisting in the body? Can we minimize that? Especially in upper extremities, looking at minimizing any neck twisting. And how that impacts the upper extremities. You want to look at the tools someone's using. So looking at ergonomic tool design and making sure that that fits within standards. Where are the tools kept? Do we keep the elbow at 90 degrees, avoiding any reaching overhead or reaching forward? Looking at the grip that's required on that item, so we're not gripping really small items. How much repetition, how much force is required to use that? Is the wrist able to be in a neutral position, or is it moving into awkward positions? Is it a one-hand versus two-handed tool where we can use that with one hand or alternate the hand that we're using, or do we need but two hands? Looking at the pressure or contact points throughout that tool, and where does that place pressure or contact within the upper extremity? And is there counterbalancing for those heavy tools or those tools we need to use repetitively? Is there a counterbalance or a way to offload the amount of weight that is required to use that tool? So looking at some of these examples here, looking at the neutral wrist positioning. So if we look at putting our center of gravity through that tool instead of having it up above or down below, which is going to require, again, some awkward wrist positioning depending on if it's too high or too low. We really want that to be right in line with the body if possible. And then what are some different grips that are required, and what are the postures and movements required to use the tool? So again, that's really going to come in your observation and assessing postures while someone's using different items. Some general tips around tool use is we want to make sure that we bend the tool and don't bend the wrist. So looking at the wrist positions when someone's using that tool to determine, is this the right tool? Do we need to consider a different tool? Or do we need to consider modifying the workstation to allow working at a different height that will then impact the position of the wrist? Looking at avoiding high impact forces or any static loading, looking at how long someone has to sustain a position, excessive gripping, those awkward joint postures as we talked about. We also want to reduce vibration because that vibration can really aggravate conditions. And what types of grips are we using? Is it a trigger grip or a power grip? And where do we place those tools? So making sure that that's within a reasonable reach distance and we're not creating awkward postures by placing those tools in different areas. Now, I'm looking at the time. I'm going to skip over the last two slides. They were just some case studies around identifying different risk factors, but I do want to leave time just to see if anyone has any questions. I've left you some resources there. But yeah, just want to leave you with thank you for joining today, and a reminder for anyone who's not already in the membership that our membership is now open. And this is just an example of one of the topics that you would be able to have access to by joining our membership. So we wanted to give you a taste of what those monthly memberships look like, what types of knowledge you get from those. And right now we are offering 25% off until April 14th. So you've got some time to learn more about it, talk to us about it, ask us questions. Basically what you get with that is a monthly webinar, such as today. So you join the live version, but as a member, you get the recording to access whenever you want or need. You also get a tool for your employees. So I mentioned earlier that self-assessment for your ergonomic workstation to be able to provide to your employees to show them the health and safety commitment and help them to be as healthy and safe as possible. You get a 30-minute consultation every month with one of our experts or a clinical lead occupational therapist to be able to chat through some of your concerns or your difficult cases. You also get 25% off of any of our other workshops or online training or certificate that we do offer, as well as our live training and our in-person training. And there's always bonus activities, ability to connect with other professionals in this field. And so if you want to learn more, there's our website right there. Please also feel free to reach out to us to ask us more questions about this. Our topic for April, just so you're aware, is conflict resolution in the workplace.